So, good morning, good afternoon, good evening to wherever you are listening to this from. So, I'm Victoria and my company is Ametrine Holistics Limited. I'm a people and pet therapist, medium and healer. And as part of my podcast, I wanted to record a series of interviews with other animal professionals who could help your pets alongside traditional veterinary medicine. So today I am interviewing a lovely holistic vet called Vickysimon. Her company is actually called holisticvetvicky, and her website is of the same name, and I'll share that at the end of those details if you'd like to get in touch with her. So welcome to this interview today, Vicky.
Thanks so much.
You're very welcome. Thank you for doing this for us, because I know for me, my whole reason for doing this was the fact that with my own cat, we've been through stages of having acupuncture with her and osteopathy and chiropractor work. And with a couple of those, I never realized they even existed. And it was a case of, well, if I didn't realize they ever existed, then I'm pretty sure there's going to be other pet owners out there who are very similar to me that didn't obviously know that these services are available. So how many years have you actually been a holistic vet now?
So actually, I have been doing some form of holistic medicine ever since I graduated, which was 2012. So I immediately started doing a veterinary herbal medicine course.
Okay.
And then I got my first job, which was at an integrative veterinary practice. So that was doing all normal conventional medicine alongside holistic medicine. And my second job was in a similar practice. Both of my bosses were human and animal homeopaths. So did lots of homeopathy there, all raw feeding practices. And I brought herbal medicine to those practices, and we started learning acupuncture there as well. So really my whole veterinary career. So it's been, must be 12 years now that I've been doing holistic medicine for animals.
Fantastic. And I love that, because I love the fact that obviously the places that you've worked have been very open to this. And for me, it is about that, it is about that both sides. It's the same as in some respects, obviously, what I do. When I work with pets, it's like I don't do that instead of veterinary medicine in any form, holistic or traditional, but I do it in terms of actually there are some things that are psychosomatic that actually I can work with because of obviously my background. So I love the fact that, as you say, it's very integrative, and it's very it's all complementary, it's all working together. And I think that's the whole thing of it, really, the holistic side of it, isn't it? It's working with the whole of the pet, because you've got physical, mental, emotional, and if we want to push it further, energetic and spiritual. So
Absolutely. And, just because I do just holistic medicine now, it doesn't mean that I don't still send my clients back to their conventional vets if they need, conventional diagnostics, or maybe they need antibiotics or some other kind of conventional medication. And it's not that I'm completely against those. That's just not what I'm offering.
yeah. And that, and of course that then makes, I'm sure, somebody feel safer, because they know that you're authentic enough to say, actually, yes, you do need to go back to them. The same as if I'm not a vet, I'm not a nurse, but if I see something that I think I'm not sure about this, or somebody mentions pain or a behaviour that's very sudden, the first thing I say to them is, have you been to see your vet, just to check it's not something medical, clinical, pain related, especially if it's a sudden occurrence. So as you say, it's all sides working together at the end of the day, isn't it? So okay, so I know obviously our listeners, if you like, are going to want to know, what would you say are the differences between a holistic vet and a traditional vet?
I mean, obviously the big one is what we're going to be prescribing. So your holistic vets are going to be using herbal medicine, homeopathy, acupuncture, natural dietary alterations, or whatever else they happen to be practicing, instead of your drugs and surgery and that sort of side of things. But I think also just the general approach to the animal. So, holistic, like you mentioned, it's holistic. It's taking in the whole of the animal and their whole life experience into account. So in a holistic consult, it's going to be a much longer experience for the owner. And there's going to be involved a lot of, so I always start by just observing the pet in the consult room. What do they do? How do they interact with the owner? How do they interact with you and their surroundings? How is this experience of them coming somewhere they've never been? How do they interact with that? And then obviously lots of detail about their lifestyle, their diet, their likes and their dislikes, their personality, their emotions. You're literally trying to get to the whole picture of the animal, so every aspect of their life. And then you're using that to come up with your plan. And obviously that whole picture includes whatever disease they might have, whatever symptoms they might be displaying, how that disease or those symptoms express in that particular animal, because hundreds of animals can all have the same disease, but it can express in slightly different ways for each of them and make them all feel slightly different. So it's finding out all of those nuances that are unique to that animal, and then using that to help you come up with the best management plan.
Yeah. Yeah, again, and for me, I love that because I'm like a really detailed person, and I love learning. And to be quite frank, like I get quite excited when you're telling all of that, because I'm like, oh, that must be such an amazing consult. And I know in a slightly different way, I'm quite similar when I do my consultations. I'm looking at everything. I'm looking at, as you say, their relationship with the owner, because a lot of what I do is working on the pets are often our mirrors and our messengers. So, if there's if I'm going to see a pet, for instance, that's suffering with grief, it's very, very likely there's somebody in the household that's grieving, and we might need to look at that. Or it might be that the pet is sitting on their feet, and so often this says to me, okay, this person is possibly ungrounded because the pet's trying to ground them. So we're looking at the pet's behaviors and what's going on and the symptoms, but also at the same time we are actually observing as well. So I love what we do already. I'm just like,
But there's lots of overlap, I think, because one of the huge things in homeopathy, particularly, that you always want to know is what's been going on in the animal or the owners or the household's lives at the time or just before the disease started.
Yeah.
And quite often there's really interesting things that you can find that coincide. So, the month before the pet was, or a few months before the pet was diagnosed with cancer or something, the owner's father died, or, they had a divorce, or, there can be all of these really, when you start looking at it, you think, well, obviously that would have a big impact on the animal. And you can see how these kind of timelines can end up affecting pets.
Yeah, and even things just, I suppose, more things like moving home, or I've had pets get quite distressed because it's been Christmas and they've moved the settee to put the Christmas tree up, and they don't like all of this change, because it's changed, in a sense, it's changed the energy of the room. It's like pets picking up on the feng shui side of things, in a sense, but they pick up on energy very easily. They pick up on us very easily because of our heart-to-heart connection. And just kind of it's made me also think of, do you work very much with, obviously if you do acupuncture you'll work with meridians anyway, but do you work with their energy? Do you work with chakras at all, or is that something not quite for you?
I usually don't in my practice, but I'm obviously aware of all of those things, but I don't tend to have any particular chakra focus on anything that I'm doing. And I think it does vary a bit between pets, how aware you can be of those things, because I think a lot of owners aren't so aware of those. Some of my more spiritual owners might bring those kind of things into the consult, and then maybe that's something that we'll take into account. But I also have a lot of very conventional owners that are coming because, I don't know, maybe they've run out of options on a conventional side, or they don't want their pet to be on permanent medication, but otherwise they don't really have any experience of the alternative side of things. So in those pets we tend to stick much more with the what's comprehensible and understandable for everybody.
But again, that's that flexibility, isn't it, and allowing people to be in the space that they are, but actually working with them and their pets in the way that's still obviously the best possible result for the pet themselves as well.
And that's part of holistic medicine. The whole picture also takes into account the owners, and I think it's easy to forget that, and something that I talk about particularly a lot with quality of life cases in end of life care, where it's not just about the quality of life of the pet, it's got to be the quality of life of the whole household. Because if caring for your pet so intensely is having such a negative impact on you, that is going to be having a negative impact on your pet, and therefore it's got to be taken into account in the whole quality of life discussion when you're in those kind of cases.
100%, yeah, I would totally agree with that, because if they're getting very stressed and very anxious, the pets are going to pick up on that, and then they're going to respond to that as well. So yes, it definitely does. And certainly from the work that I do, I would agree with you on that. And in terms of homeopathy, I mean, I don't have a vast knowledge on homeopathy, but certainly from when I've experienced it with myself, I know that there's a lot of finite information, if you like, that somebody needs to prescribe a certain remedy. Is that very much the same with animals? That, I mean, some of it is probably a little bit harder for people to say, you know, are they better in the cold, are they better in the warm, and things like that stuff. But is it a similar thing that you have that same kind of, like, we want to know that information, are you better moving, are you better sitting still, and so on?
Yeah, absolutely. So I ask all of those questions, but I don't always get all of those answers. But what I find really interesting is that after that initial consult where I ask all of my detailed questions, sometimes on later consults when we have follow-ups, people will come back and they will say, I've been watching and I've noticed that they're actually better for being warm, or they do actually tend to prefer to lie in the shade when it's a sunny day instead of the sun, or, you know, those questions that you first ask that they can't answer, they have then taken that on board and are observing their pet in a different way and are better able to answer your questions in the future. And I think, you know, if people have never experienced a holistic consult, sometimes I ask questions and people just laugh and they think, like, I just wouldn't have dreamed anyone would have asked me this about my pet. Um, and but later their brain starts to change in the way that they're answering your questions. They know the kind of weird things that you're potentially going to ask, and they're trying to be a bit more prepared for it.
Yeah.
And so I think the more experience somebody has working with holistic practitioners, the better they're going to be able to answer your questions.
And also I can see how it would actually deepen the relationship that they have with their pet as well.
Yeah.
Because, and I'll definitely hold my hand up, when I saw a homeopath, obviously she had to ask all of those kind of questions. And I, even for myself, I sat there and was like, okay, does that headache get worse in cold or warm? And I'm, you know, like, I'm really having to think about the information that she's asking. And similarly, I would say, I'm not sure, but let me park that and I'll tell you when it happens, sort of thing. So it's, as you say, it's wonderful that they are taking it on board, it's lodging there, and the fact that they're then observing their pet and starting to see that more, it is deepening the relationship. They're getting to know their pet better. And I think that's wonderful. I know, you know, with Puss, I've definitely got to know her nuances. And it probably makes for a much better consult for you when they come back and say, right, okay, I've been doing these observations and I am noticing this and this, because then, of course, I'm sure your cogs are where I'm going to go, fine, okay, I'm going to add that. And right, okay, that makes sense with, you know, and you're sort of like creating that kind of diagnosis in your mind as they're obviously then adding to that.
But there's also, you know, different levels that you can be prescribing on, particularly with homeopathy. It's very easy to see those different levels. But the better someone knows their pet and the more detailed of those questions those people can answer, the more likely you are to more quickly find the best remedy for them, and to be able to prescribe it at a high enough potency that you're going to see more permanent results from it. Whereas if people, you know, some people, maybe they've only just adopted the pet, or, you know, the pet spends a lot of time outside, so they don't see it very much, or they just don't have that sort of level of connection with them, you can still prescribe for them, but you're prescribing much more on the symptomatology rather than on who the patient actually is. So there's all these different levels that you can be working on depending on both the pet and the owner and the whole pet owner relationship.
Okay, thank you for that, because again, I'm sure our listeners, you know, it's certainly allowed me to understand more of what a consult would be like. I mean, I know obviously, you know, I say GP, but general practice consults with just, you know, with a traditional veterinarian are probably ranging from about kind of probably 15 to 20 minutes, aren't they, very often? It definitely sounds like, obviously, your consults are much longer. Are they kind of like an hour and a half, or?
Yeah, so a first consult for a chronic disease problem would be about an hour long, but I usually leave an hour and a half slot so that we've got time to run over, because some of the cases are much more complicated, whereas some of them you get all the information you need much quicker. So yeah, between an hour and a half, and then follow-ups would be between, you know, 15 minutes and half an hour or something like that.
Yeah, okay. And when people have follow-ups, are they in person, or can you do those online by telephone? Because I know some vets differ
Depends
on that.
on the patient and the condition. So, you know, for a lot of patients, there's not much on a physical aspect that you've actually got to look at. So, you know, some of the, gut disease cases where they've got diarrhea or something, you feel the gut, there's nothing to feel. What you're going to feel at a follow-up. So most of it is just, you know, discussion about how they've been. Same with behavior cases and some skin cases where they're just itchy, but there's no lesions and they don't develop any. Whereas there's others where obviously, like, again, skin cases, you want to see how those lesions have progressed or
Yeah,
what's changed, or ears or eyes where you've actually got to look into them, or the mouth, something in the mouth.
yeah,
Those ones you really do have to see in person because you want to be able to see what's changed. But I do have clients that come to me from really far away, and so sometimes what we do is we do our follow-up on the phone or by video, and I just make sure that before we have that, they've been to see their local vet, and their local vet sends me a history of whatever their physical examination has found. So
okay.
it's not as good as obviously you seeing it for yourself, but it's kind of trying to work out the best option for those pets and their owners.
Yeah. No, that makes absolute sense. And obviously, as you say, again, you are keeping the pet's welfare at the highest quality. And obviously, at least then, you know, people's vets are still kind of kept in touch. And on a clinical level, hopefully then they're satisfied that obviously, you know, the two sides are kind of playing together, if you like, as well. Okay. And when would somebody, in terms of coming to see a holistic vet or a traditional vet, when would someone make that decision as to, actually, I feel I need to go to see a holistic vet now? I mean, I know that's probably a needle in a haystack, but
I mean, I would say partly just because I know how busy all the holistic vets in the UK are, because there aren't very many of us. Mostly, you would come and see a holistic vet if you've got a chronic disease. Whereas if you've got an acute disease, so, you know, your dog's just wounded itself, or they've got just developed diarrhea, or, you know, something like that, you'll probably go to your conventional vet, because they'll be able to have an appointment for you much quicker. And most of it is just sort of a quick firefighting thing. And then usually it just resolves itself and then the pet's fine.
yeah,
If it doesn't resolve itself or a chronic disease is diagnosed, chronic disease is really where holistic medicine comes into the fore,
okay,
because conventional medicine is very good at treating acute problems, but it is not so good at treating chronic problems. There are a very finite number of medications that tend to be used for chronic problems, you know, steroids, antibiotics, anti-inflammatories.
yeah,
That's then it runs out of other things, maybe like a special commercial diet or something like that. Whereas with holistic medicine, we've got a whole plethora of different things that we can use to try and help treat chronic disease. So what I usually say when people want to register with me, but their pet doesn't have a problem, I usually say, if you have an acute problem that's not going away, or your pet's diagnosed with a chronic disease, then get back in touch and we'll book an appointment.
yeah. That makes absolute sense. Okay, and kind of leads nicely on to my next question, which is, you know, what, as a holistic vet, I think a lot of people be like, well, what can you treat, what can't you treat? Now I know obviously you've kind of like hit the nail on the head there by saying, well, acute is more your own vet, and if it's acute and not resolving, come and see us. If it's chronic, come and see us. But what, in terms of like conditions themselves, what kind of things do you tend to see quite often, but also like what can you treat?
I mean, in terms of what I can treat, I can't think of anything that I've said I wouldn't at least have a go at treating,
Yeah,
because even if it's not something I've treated before, there's always something I can think of to try on a holistic basis. Because a lot of what holistic medicine is doing is it's kind of working to support the whole body and encourage the body in its natural healing and natural health and natural immunity and everything like that. So it's rare that somebody would contact me and I would be like, well, I really don't think I could help you. There's usually something I can think of, even if I can't guarantee that it's going to do anything to help. There will be some logic behind my ideas for how we might be able to help the pet. In terms of what I see most often, I think probably the things I see most often would be cancer, arthritis, skin disease, behavior problems, chronic gut problems. They're probably the most common.
okay. Lovely, thank you. Because as I say, you know, for listeners who are obviously listening to this, you know, that way it's just allowing them to understand, okay, you know, I have been thinking about it, but I have not been sure how to approach it. And actually just on that level, if somebody wanted to come and see you, I know in veterinary referrals, when that happens, when somebody needs to be referred to a specialist, although a client can ask to be referred to a specialist, it normally is the vet that needs to obviously send over the history and the x-rays and bloods and any other tests and results that they've got, and it tends to have to kind of come more from them. As a client, would we be able to just come straight to you and say, actually, I'd really love to see you in conjunction with my own vets? Does it still need to come from someone's traditional vet, or can they approach you
It does
directly?
still have to go through the traditional vet to a degree. So
Yeah,
I do have a referral form that I like owners, regular vets to fill in. Quite often, their conventional vets are less keen to fill it in because to them, they're not recommending a referral. But what they usually do is they just write in the reason for referral, they just write owner request.
okay.
And most of them seem perfectly happy with that. I've only had one or two that say they won't fill in the form because they're not referring the pet, because the owner is. But the main thing is that legally we're required to have a copy of the animal's medical history before we can
Yeah,
see the pet. And that would go for if you wanted a second opinion from another vet, or you were changing vet, anything like that. Before you see a pet
absolutely.
as a vet, you're supposed to have a history from their regular vets, so that obviously you know if they've got medication, adverse reactions, or
Yeah,
other diseases going
contraindications.
on that the owner's not mentioning to you, or anything like that. So that's all just part of the kind of the legal side of things
Yeah.
that just protects us and makes it able for us to keep on treating pets.
Yeah, absolutely. No, I mean, I had the same thing with Bruce when I changed vets. Um, only because I suppose I already know to do it because of working in vet referrals, but I did absolutely say to my old vets, could you send over her history, all of her test results, all of her x-rays, you know, so that actually they had kind of everything, so that when we had that first consult, they were already able to read her history and what had gone on. Partly also out of respect as much as anything, because otherwise this poor new vet that you're seeing literally has got this cat plonked on a table and has no idea what's going on. So,
Yeah.
you know, for me, definitely also it's a respect thing and courtesy that, well, how can they help my cat if they don't have all of the information to hand that they're going to need clinically?
And
So
it's also
yes, that makes
useful for
sense.
owners, I think, because I get a lot of owners where, one of the first things I always say to people is, I know I've got the history, but pretend I don't know anything and tell me what's happening, what I can do to help you. Because I
Yeah,
think that's a good way of starting owners talking about a problem. And quite often what they'll say is that, first it started with this. Was it a month ago? Was it 2 months ago? Was it in July? And they just, they can't quite remember the timeline. But if you've got the history, they don't even need to. And I just go, don't worry, I can just look up that if I need
yeah.
to. And then, you've just got all of the dates that you need without anyone having to, really rack their brains for the exact time that anything kicked off or finished or whatever.
But I like the fact that you do ask them, because the thing is that certainly from the veterinary records that I've seen, and this is no disrespect to any traditional vet of the way they do that, but they would never ask me, and therefore it would never be on the history of something like you said earlier, where, well, this all started when, you know, my husband passed away, or we moved house. You know, that wouldn't necessarily be on the records, because I think they're obviously looking for the clinical signs and symptoms, the same as, you know, some of my clients might share information with me, and, you know, I write down as much as possible, and but there'll be certain things that I pull out and go, yeah, that's relevant, that's definitely relevant, you know. There's going to be that sort of difference in a sense, isn't it? So at least when you've got the clinical information, then obviously by the saying, tell me a little bit about what's happened and when it started, they can give you kind of that extra information that you're going to be asking anyway.
Yeah.
So I like it on that level as well. Now, one thing that's really biting at me, I can literally, I don't know whether it's spirit or whether it's just my curiosity, but with homeopathy, I know obviously often you get the little pilules, which is like a very tiny little round ball for people that don't know what it is, that you normally administer to pets. How do you find it works with cats? I'm literally curious, because I know with puss generally I've had tinctures, because trying to get a pilule into her would be an absolute nightmare. So I'm literally just curious about cats.
So different techniques for different people, different pets, different pairings of people and pets. Sometimes I prescribe in a liquid form, and people find that easier.
Yeah,
Sometimes if they can't administer the liquid directly into the pet's mouth, which is the best way, I'll get them to give it in just a tiny bit of a really bland liquid. So usually, like, I'll say, get a teaspoon with a little bit of milk in, and then put your like 3 drops of the remedy into that and get the cat to lick it off the spoon, something like that.
yeah,
If I prescribe the tablets, because some people prefer the tablets, either they will just stick it in because their cat's very amenable, so they just pop it in its mouth and job
yeah.
done. Other people will crush the pill between 2 teaspoons, so you've got a bit of powder. Tip that in, because it's hard to spit out a powder if you're an animal or a person.
True.
Or with the crushed tablet, you can also get a tiny bit of, again, something really bland, so it's not going to be interacting with the remedy at all. So tiny bit of butter or natural yogurt or cream cheese or something like that on the tip of your finger, dab up the powder and get them to lick it off.
Love that. Because yeah, she definitely wouldn't take the pill as is, you know.
Yeah, no, lots of different techniques that I've developed over the years.
I love that. I mean,
But
it
I've
is,
also had people just give it in the food.
yeah,
And do you know what? It's not the best way of giving it by far,
yeah,
but I have seen cases where they respond amazingly well despite it being given in the food. So,
yeah.
there's always a way of getting around difficult animals.
She's not difficult. No, no, she's very headstrong, I think is how I put it.
I should have
Headstrong,
said
feisty.
difficult to dose
That's
animals rather
okay.
than difficult animals.
I mean, I am sure I am going to ask you this question, but I know when Preston have some just normal like pharmaceutical drugs, if you like, veterinary drugs. There was one tablet in particular that she would fight me tooth and nail. She would not have it in any manner or form. And something said to me, I felt like it was as if she was recognizing that the vibration of that tablet was not right for her, because she would take another tablet. So it didn't feel, do you see what I mean? And they were the same size tablet. And it really felt, do you find that just on a general, I'm not talking necessarily specifically with that, but do you find that with it, like with anything, it's energy, so that they are able to pick up on a vibration of something like either a veterinary drug tablet or a homeopathic essence, such that they will either take it easier because they feel it's going to help them, or they resist it completely because they feel it's not right for them.
Yeah, absolutely. And I think the way that I see that most is where sometimes someone will get in touch and they'll say, "Oh, my pet has just started being really difficult taking this medication when they were taking it fine before." And I usually say, "Well, let's just try stopping it and see what happens." Because I sort of figure that maybe they're saying, "Actually, I've had enough and I don't need it anymore." And maybe
Yeah,
we can stop it and they'll be fine.
yeah,
But obviously, if they're not, you're in contact with the owner and you can always try restarting again in some other way.
yeah. Okay. This is what popped into my head. But do you know what? I am just going to ask as we're having this chat, because again, other people might have experienced that themselves. As I say, mine wasn't with a holistic medication or homeopathic essence. It was, with the veterinary drug, and there might be someone else out there that's the same thing. And I've never had that thought before at all. And I have had quite feisty cats. I always seem to get like the part ferals, or like really feisty. I don't know whether it's saying I'm really feisty. Probably am to a point, but I've always been able to kind of bring them down, calm them, and obviously allow them to perhaps feel safer. Maybe that's what it is. But yeah, so that's just why it kind of popped into my head. And for yourself, what other than obviously traditional veterinary medicine, what other qualifications do you have that makes you a holistic vet? It sounds so acupuncture is one of them.
Yeah, so I mean, it's really just about different training that you've done. So I've obviously done some training in acupuncture, in herbal medicine, and in homeopathy. And then I give a lot of dietary advice. I don't have any nutrition qualifications, but I've done a lot of reading around natural feeding and natural nutrition.
Yeah,
And I think, there'll be a huge spectrum of different qualifications from different holistic vets. And all at different levels. Some people have diplomas, some people have certifications, some people have just done more basic courses, but have then practiced for a long, long time afterwards.
yeah,
So It'll vary hugely between different holistic vets, but it'll be some kind of additional training on top of the conventional veterinary training that you have to do in order to be a holistic vet.
Yeah, I mean, certainly the one that's sort of in my local area, I know that she does chiropractic. I never know what the noun is, but chiropractor work, if you like, on animals. And I know one that has osteopathy that's also part of that as well. And I suppose it's the same as, to a point, like human therapists, or if a doctor you know, trained in other therapies, he could train in a plethora of different therapies, you know, sound healing, homeopathy, energy healing, and so on. So it's not always going to be every single holistic vet has this qualification, as well
Absolutely,
as,
they're all going to
you
vary
know,
hugely.
yeah. Okay, no, that makes sense. That makes sense. And one thing I also wanted to ask around holistic medicine is, how does that work in terms of vaccinations? Because obviously normally with, you know, with your traditional vets, they will say to you, okay, go and have, you know, your annual vaccination or booster. How does that work with holistic vets? Do you still do the vaccinations? Do you do titer testing? How does it work?
So most holistic vets will be very much of the school of thought of trying to minimize unnecessary vaccination. So we're not saying that necessarily all vaccinations are bad, but we want to keep vaccinations to as small a number as possible. So a lot of vets do, a lot of holistic vets do advocate for titer testing, like you describe. And for anyone listening who doesn't know what titer testing is, it's basically a blood test that you can do where you're measuring the antibody levels to the main diseases that we vaccinate against. So it's mostly done in dogs. You can do them in cats, but they're less commonly asked for in cats, solely, I think, because cats are much more difficult to take blood from than dogs. So people don't want to have to be doing that on a regular basis.
Yeah.
But for dogs, it's distemper, hepatitis, and parvovirus. There are three main core diseases that are vaccinated against, and so they're what we're measuring in a titer test. And you basically measure the antibody levels, and if they have adequate antibody levels, it means that they effectively already have immunity, so therefore they don't need to be vaccinated. And then if they don't have adequate antibody levels, then they're potentially being left unprotected, and so you can recommend a vaccination. But what I will say about titer testing is that obviously antibodies are only one part of one aspect of the immune system. So what we can't measure is the memory cells within the immune system.
Okay.
And what happens if your body or your dog's body encounters a disease that they haven't met for a very long time, then the chances are they won't have any circulating antibodies, but there could be a memory cell in their immune system that goes, oh, hang on, I've seen this disease before. It needs this antibody. And then it stimulates the immune system to start producing the antibody again. And then the antibody levels can rise. So you obviously can't measure those immune cells, the memory cells. You can only measure the antibody levels. So I always have these discussions with people after a titer test. If they've got, say, a 12-year-old dog, and we know it's had a positive titer test, you know, say 3 years before when we last did one, but now it's negative, I would always say to them, chances are your pet has these memory cells. And so probably if they encounter this disease again, they're going to produce those antibody levels, but we can't guarantee that because we can't test it. So it's up to you whether you want to have another vaccination or whether you want to just put faith in your dog's memory cells.
Okay, no, that's great. Thank you for explaining that, and thank you for explaining what titer testing is as well, because I think, you know, even myself, to a point, you know, I've heard of it, and I had a rough idea what it was, but not in full. So it was really lovely to have that detailed explanation as to A, what's involved, and B, obviously why it's done, and the whole process behind it. So, you know, thank you very much for that. And in terms of, like, for our listeners, is there anything else that you would like to share with them around kind of holistic medicine anyway? Like, actually, one question I would have you, sorry, but is what kind of clients do you have coming to you? I know for me, because I've gone more down the holistic route, because I'm very sensitive to just general pharmaceutical medication, and that kind of pushed me and led me into realizing that actually I feel, for me, more of a holistic route works. And of course, then when I found that Puss was very sensitive to medication, that's when I started looking at other ways to help her, that would then obviously work with her system. So I know for me, going to holistic, that would make sense. I'm quite spiritual. I'm quite holistic, as I say, with the way I treat myself, quite open to that. Do you get a lot of clients that are very spiritual and open-minded to that side of things, or do you get quite traditional people? I mean, I know you did briefly touch on earlier if you had sort of conventional sort of pet owners, but do you get a mix or?
Yeah, I get a real mixture actually. I do get a lot of people who are very interested in holistic medicine and practice it for themselves and very spiritual and all of that side. And I think for them, it's quite natural to seek out a holistic vet. It seems very normal. But I also get extremely conventional people that have no idea about anything to do with holistic medicine or alternative medicine, but they've been in kind of put in a situation where they've been given very little options from a conventional medicine perspective, either because their conventional vets have tried everything within their arsenal and nothing's worked. And so
Yeah,
they've kind of gone, sorry, we don't really know what else to do, which, does sometimes happen.
yeah,
Or they've been offered an option that might be, for example, cancer cases. Well, we've got chemotherapy, we've got radiotherapy, or you can just have some steroids and take your pet home and wait for them to die. And a lot of people don't want to just sit around and wait for their pet to die of whatever
absolutely.
disease it might be, because
Yeah.
sometimes that happens with other things, kidney disease or other things like that. And they want to be a lot more proactive in how their pet is cared for. And so those people then start thinking, right, what else could I be doing? And they might start researching. And obviously, with the internet, you can quickly come across people talking about how different holistic medicines have helped their pets. And so then they start looking into that as an option. Or, they mention it to a friend, and their friend says, oh, I went to see so and so, or my friend went to see so and they did this and it was great, or whatever. And so it can be their first experience of any kind of complementary medicine when they come to me. So yeah, I get a huge range of different people from all different backgrounds and different experiences, and that is also super interesting.
Yeah, no, I can completely understand. I mean, it's certainly with my own clientele, I can get people that are, again, very holistic, very spiritual, very open to, lots of the different modalities that are available. And then I will get, someone else who isn't. But it, again, a similar thing where they perhaps tried dog training and they tried behaviorists, whether that's cat, dog, horse, whatever. They've been to see their vets. The vet says it's nothing clinical, so they feel stuck. So a lot of the time I find when they come and see me, it's like they've exhausted all options that they know. So they're like, right, what have I got to lose? Let's try this.
Yeah,
Um,
desperation leads to a
yeah,
lot of new experiences for people.
yeah, absolutely. And I find sometimes when they are, when it's people who are more sort of have been down the conventional route, I often find it's that first stepping stone in their journey on kind of the holistic level, and that kind of opening up to them in all the different ways that it can. Because as I say, I find that often it will deepen the relationship between the pet and the owner, or sometimes I will say something to them and they go, do you know what, I thought that I looked at them the other day and I really thought it was like they were talking to me, and it was like they were giving you that message. You are in tune with them much more than you realize.
Yeah.
So I find that as well, they start to trust their own intuition more. They trust what they're observing and seeing more, which I do feel does make a massive difference. So I think there's so much to be had for consults like yourself, like myself, like anybody, who's working with animals. Even with traditional vets, have you observed them doing this? And people might go, I don't know, I hadn't really thought about something like that, and then they'll go home and a similar thing can happen. So we're not saying it's just with holistic, are we? It's a similar thing. But as I say, there's just so much that can come out of that consultation.
Yeah.
And you did touch on obviously about, the researching. That's one question that I'd written down to ask you was, if somebody was looking for a holistic vet, because I know you've got like the RCVS website, which is the Royal College of Vet Surgeons, for those that don't know that abbreviation, where you can go and search for a vet. Is there one for holistic vets that people can actually go and look at and, maybe put in their area, and it will show them who is available?
So there isn't specifically for the broad category of holistic vets, although I think it would be a great resource if somebody did want to set one up.
Okay,
But
I'll write that
there
down.
is a British Association of Homeopathic Veterinary Surgeons, so the BAHVS, and we have a website which is bahvs.net, and on there there's a find a vet section with a map where you can look up the different homeopathic vets around the UK. And then there's also the British Association of Veterinary Herbalists. And we have a website which is www.herbalvets.org.uk. And we also have a Find a Vet section on there. So you can look up your region of the country and the different vets in that particular region. And then you can see who's going to be closest to you and get in touch with people.
Okay, fantastic. Thank you very much for that. I've written that down, and then obviously I can share that in the notes for the interview as well.
For acupuncture, there is also a similar thing that ABVA has one too, and possibly there's another website for the acupuncture vets, but I can't remember it off the top of my head. But acupuncture vets tend to be much easier to find than homeopathic and herbal vets, because there is a lot more acupuncture vets than there are vets doing homeopathy and herbal medicine.
But and again, I mean, I know with first like that was through our own traditional vets. I was searching for acupuncturists, veterinary acupuncturists, and it came up saying, "Hey, the vet that you actually already see does this," and I was like, "Oh, you know." And again, they hadn't shared that at all. I had no idea.
And generally, most conventional vets will know of a veterinary acupuncturist in their local area, even if they don't have one within their practice. Whereas I think they're much less likely to know about homeopaths or herbal vets.
Okay, thank you for that. What would you say, because I know you touched on it again sort of earlier in the interview, about that some vets will refuse to kind of fill in the form and that side of things. What do you think is the reason? And I know obviously you might only be kind of guessing here, but what do you think is the reason as to why a vet may be so against, if you like, or resistant about, you know, allowing someone, it's not even referring them, but allowing them to come and see a holistic vet? You know, what's the kind of the
generally
conflict?
It's not that they won't allow the owner, but the thing about filling in a referral form, I think some vets feel that if they look as if they're recommending holistic medicine, it implies that they believe in it and they think that that would be the best option for the pet. And I think that's what a lot of these vets are more resistant to say, that they necessarily believe in it. It's not that they're going to stop the owner, because when it really comes down to it, it's your pet, it's your decision what you do with them. So even if they don't want to actively refer you, they can't really say no to you seeking a second opinion from a holistic vet, and they would have to send the history and everything like that. So that tends to be my general experience. Although they may not like it, they're not going to refuse it. And I think a lot of that is just, you know, their beliefs, their understanding of holistic medicine. In the vet world a few years ago, there was quite a lot of attack against holistic and complementary therapies, with a group of vets trying to stop vets from being able to practice homeopathy and other alternative therapies. So there's still a lot of that mindset, I think, within the profession. And yeah, I think that's just really discouraged people. But as an owner, it's your decision, it's your pet. If you choose to seek help from a holistic vet, then, you know, I've had a couple of people where we just have it as a second opinion, where their vets aren't very happy with it. But in the end, you know, nothing that I do is interfering with anything that the vet's doing. I communicate with the vet and let them know exactly what I'm doing. So they haven't really got any reason to not be allowing it, and they haven't really got any right to not allow it, because it's, as an owner, it's your pet and your decision.
Yeah, okay, thank you for that. And actually just leading on from that, so if there was somebody here that's saying, actually I'm, you know, partly fascinated by what you do, I mean, I could talk to you forever, but you know, if they're like, yes, do you know what, I really feel like this is a route I would like to explore, how would you say might be the best approach for them, the best approach for them to approach their own vet, about obviously saying that they want to either seek a second opinion or obviously see a holistic vet alongside their traditional vet?
I mean, really just to bring it up in a consult, or to see if you can speak to your vets on the phone. And I always say to people, you know, make it clear to your vet, you're absolutely not leaving them as a vet, because I only work as a complementary vet. I'm not ever anyone's sole vet. I don't offer any emergency or out of hours cover. I don't have the surgical theatre. I can't do any diagnostics. All my clients have to be registered with a conventional vet as well. So I'm in no means competing, and most holistic vets aren't competing with anything that your regular vets are offering. So if you just say to your regular vet, I'm really interested in discussing this case with a holistic vet and seeing what they might have to offer, You know, do you know any, can you recommend anybody? Or if I find somebody, would you be happy to send the history over or discuss the case with this other vet? And, you know, most vets are quite open to it, especially in some of the cases that I've discussed, like cancer cases, or, you know, I had this case recently that was a really severe immune mediated disease that was responding really poorly to the steroid treatment. And, you know, the conventional vet was also, I'm imagining, feeling pretty desperate about this case. They thought they were going to have to put the dog to sleep and all of this kind of stuff because it was just doing so badly. And so they were actually quite happy with the prospect of, and some of my other cases, particularly chronic skin cases, I think the vets must be quite pleased to be like, oh yes, please, somebody else have a go because I'm really struggling here. So I think just chat about it with them and you'll quickly get an idea of if they're going to be for it or against it. And if they're not actively for it, there's no reason that you can't do it anyway.
Yeah. And just say, well, you know, they are my pet and this is something that I would like to explore. So I've
And,
found
you know,
that.
it's seeking a second opinion. It's trying to see what else might be on offer and whether that might be able to help your pet.
Yeah. Because at the end of the day, you know, they're not saying, you know, oh, you haven't done your job properly, or you've not been able to fix my pet, or anything like that. We're just saying, actually, do you know what? I just want to explore a different route. You know, the same as with myself, I was diagnosed with fibromyalgia at the age of 25. I was told by a traditional doctor, this is it. You've got this now for life. It's going to get worse. Honestly, this is what they actually said to me. You know, you're going to end up in a wheelchair with 2 walking sticks, and you're probably going to get rheumatoid arthritis as well. And I was like, whoa, okay, that's a
So
lot to
positive.
take on. Yeah, exactly. I was like, wow, you're the messenger of doom. You know, and it was a lot to take on as a 25-year-old, that basically underlying that whole statement was your life is over. You know, it's just going downhill from here. And luckily for me, I'm quite stubborn. That's probably obviously where Chris gets it from, but I'm quite stubborn. I was like, no, I don't want a condition, you know, to rule me. But I've had to go much more down the holistic route to explore trauma, to explore past lives, to have osteopathy, energy healing, sound healing, you know, acupuncture, loads of different therapies. So really approaching it from a holistic level. And it doesn't mean that I'm dissing my doctor by doing all of that. I'm just saying, okay, that's your view of it. This is your perspective based on your training, based on all of your knowledge, your research, all of the books you will have read, all the CPDs you'd have done, etc. However, I differ to what you're saying. To me, I wasn't, and I think because also I'm very into metaphysics of the body, and that also applies to animals as well, as far as I'm concerned, the metaphysics of the body. And for anybody that's out there listening, you know, metaphysics is all about kind of what's going on in the body. You know, our highest self speaks to us through our emotions. If it can't get to us through the emotions, then often it will use the body. And metaphysics is exploring what emotions very often and thinking is underlying any kind of dis-ease in the body. And I've had to look at that myself with the fibromyalgia, but also I then looked at it with Puss on a similar level of, okay, what might be going on for her based on, you know, what she has, what her symptoms are, what her conditions are. But, you know, as I say, with mine, it's not saying, oh, my, you know, my doctor's useless, he hasn't done his job. It's just saying, you know, from his world, his, you know, his values, his beliefs, his everything he's been through, all his experiences, all he's seen is fibromyalgia is a chronic condition, it's long term, you know, and this is what happens. Whereas actually you're going, okay, so I'm going to go and visit a few other people because I know some people that have actually physically got rid of it. So it's like, so I'm going to go and approach them and ask how they did that. Because if I wasn't born with it, then something has happened in life, created in life, for me to now be doing it. And so I sort of do look at it from that level with pets as well. If they weren't born with something, something must have gone to create that. And yes, we know that that could be something to do with an owner. It could be something to do with an environment. It could be a toxin. It could be a chemical. It could be anything and everything, really, couldn't it? Lifestyle, you know, how they're feeling, the experiences they've gone through, the owners that they might have had, the traumas they've had. It could be the diet they're on. It could be anything and everything. And that, I think, is what I like about the holistic side of things. It's looking at every single thing, in a sense, to try and get the bigger picture of what's going on, in that sense. So Is there anything else, just before we sort of wrap up today, is there anything else that you feel like you would like to share with somebody out there that is perhaps new to this, is listening to this interview, is quite interested? Is there anything else that you might think that they might need to know? I know we've gone through kind of what the differences are. We've obviously shared, you know, where they can search for obviously a holistic vet or an acupuncturist, even if they want to start on that level, what kind of things you treat. Is there anything else that you think they might want to know at this point?
I think the main thing is I feel like I said that holistic medicine can only treat chronic disease, which is absolutely not true. Holistic medicine can treat acute disease, but I rarely do in my practice because I just book up too far in advance to regularly fit in acute disease cases. But I want people to know that actually holistic medicine can be amazing in acute disease as well as in chronic disease. And there's lots that you can do just as pet owners without even necessarily having a holistic vet on board. So, you know, you can buy yourself a homeopathic pet first aid kit. And it comes with a little booklet inside that tells you about different conditions and which remedy you might choose to give. And you can start to get your own little bit of experience of treating chronic disease. And, you know, there's a few other little like first aid remedies that you can have in your cupboard that are just things that can be really helpful on a holistic medicine basis. And you can start using those. So my big two would be like marshmallow root powder and chamomile tea. You know, it's so simple. Chamomile tea. I mean, who doesn't already have chamomile tea in their cupboard? But there's so much you can do with it. You know, it can be an eye wash in conjunctivitis. It can be a skin wash to help with itchy skin. It can be given internally to help calm dogs or to help with digestive upsets. And that's just one herbal tea bag. So
And with that, sorry, go on.
there's just so much potential for what you can do with holistic medicine. And I just recommend that people start the journey in whatever way that they think is going to work best for them.
Yeah, and I know you were saying about the homeopathic remedy kit, the one that I have, and obviously I'm sure there are other brands available, but certainly the one that we have very close here in Kent is Helios.
Yes.
Helios, and they do, as you say, a specific pet kit of homeopathic essences, which also includes the SOS bar essence, which is a little bit well, it's very similar to Bark Rescue Remedy for anybody that knows it, but obviously it will be specific for animals. So I suspect it's probably either not got ethanol or alcohol in it, whichever one they would use as the main base, because I know that Rescue Remedy do that. They have a specific one for animals that obviously doesn't contain certain things. So absolutely. And I know for anyone else that's listening, well, I'll ask yourself first, but do you run any courses for people on working with homeopathy at all?
I don't, but one of my homeopathic vet colleagues, a guy called Chris Auckland, I know
Yes, that was
has been running a homeopathic or a natural medicine course for pet owners and for smallholders and whoever might be interested in learning that. So I highly recommend that if you're interested, you seek out his course because I've heard some great things from my clients who've been doing it.
Yes, and actually his name is well known also with schools of homeopathy, just for even humans, because that's where I got his name from. And I looked him up, and that's where I saw that yes, he was doing, I think it is an online course, definitely. And I think the next one does start obviously this October, and he runs it, you know, every so many months for them. And I did look at it and go, do you know what, that would be so useful for people to have. Because one thing I was going to touch on earlier when we were talking about you know, when pets are ill, is as a pet owner, it's this often we have this sense of helplessness that, you know, we don't know what to do to help them, and we go to the vets, and if obviously the vets are struggling because they can't understand what's going on, it's again, it's that sense, they then get that sense of helplessness and perhaps powerlessness. I don't know what to do, and I should know what to do when I'm a vet. And you know, so actually again, it allows that to perhaps calm, because then there's another option here. Okay, go to see a holistic vet. Actually, is this going to be helping? So I think helplessness is quite a big thing when you're a pet owner, isn't it? And they're feeling poorly, and you know, you don't want to see them suffer. You want to do anything. Most people do anything for their pets. to help them get better. And I
And that's
think,
where I think having the kit is so great because, you know, as well, sometimes a lot of vets are quite oversubscribed at the moment. So unless your pet has got, you know, a real emergency going on, you might have to wait a couple of days before you can get an appointment. Well, what are you going to do in that 2 days? You're going to get your homeopathic first aid kit out and you're going to have a go, because what's the worst that can happen? If they don't get better, you've got a vet appointment planned. If they do get better, great, you can cancel your vet appointment, or you can go in and you can say, oh, all of this stuff was going on, but I gave these homeopathic remedies and now it's all sorted. And that's also great.
yeah, because I think as vets, I mean, I know, you know, from working in vet referrals and doing what I do, you know, I know that, you know, most vets are what we would class as left-brained. You know, they want the data, they want the evidence. And so if somebody can go in and say, well, yes, they did have this, but actually this has really been helping, even if they don't understand how or why, for them to know that, okay, that's got that pet better, again, is an experience for them, you know, a positive experience. And yes, they might still turn around and say, well, that was a one-off. But if they get more people coming in where that's kind of happened, then they can start to see the benefits of obviously both of these working alongside. I know with Puss, you know, I have something, I have a liquid called Pet Remedy, if you've heard of it, Pet Remedy spray, which has 4 essential oils in it. And I use that in her carrier and I spray it all over me. And I spray it obviously on a piece of kitchen roll and then obviously wipe it on her muzzle. And it helps to keep them calmer. It helps to keep me calmer as well if I'm spraying it on me. Plus, when I've got her out in the consult room, she's no longer around the towel that's in the carrier. So at least if I've got that on me as my eau de parfum, she's also smelling it on that level. Plus, I use the triple on free download from my sound healing training. You know, that people can get that online. It's not just available to me. If you look up Suara Sound Academy, SUARA Sound Academy, and I will literally play that on my phone in my handbag and leave it just playing, not loud, you know, because obviously I wouldn't ever want anyone else to obviously be concerned about hearing it. But when I'm in the consult room, I just let it just play on my phone, because the OM frequency is all about relaxing their nervous system. So to me, by me doing just those 2 things makes her a lot calmer, which definitely makes for a better patient if she has to go through, you know, and have blood work or anything done, because otherwise she is very feisty and would definitely be saying, I don't want this, in every manner and form possible. So it is very much all about working together. So I just want to say thank you so much for all of your time today and sharing what you have. I've definitely learned a lot more about how holistic vet works, what the differences are, you know, when I feel like I would, you know, I'd be at the right time, if you like, in her journey of health to come towards you, or any holistic vet. I do know that obviously some other holistic vets are trained in things, aren't they, like chiropractor work, osteopathy. Would you say there's any other ones other than kind of the acupuncture and the homeopathy and like traditional Chinese medicine, other than the 2 I've just mentioned? Do you find there's anything else?
I mean, that's the main group, but I'll probably come off the call and think of some other things, because that's the nature of the beast.
That's fine. But again, it just gives people an idea, doesn't it? So just before we go, would you like to share your website, you know, any ways that people want to contact you if they would like to obviously book an appointment with you?
Yeah, so best thing is just to look on my website. It's www.holisticvetvicky.co.uk. And if you go to the contact page, it's got my email address. I'm always best contacted by email. If you don't do email, you can leave me a phone message, but I'm not going to lie, it takes me a long time to get back to phone messages compared to email, because I have to find a longer slot of time in the day. So best to email me. And my email address is holisticvetvicky@gmail.com.
Fantastic. Thank you very much. Thank you for, as I say, all your time, all of your energy. As listeners, I hope you've really enjoyed, you know, watching or listening to this interview, wherever you're listening or watching it from. And so from myself and from Vicky, goodbye, and hope you will listen to the next one when it comes on.